There are 1.8 billion adolescents and young people around the world. That is a massive number. So people say that about 50% of the world's population is currently under the age of 30. But young people are not actually represented in decision-making spaces. We don't get to make decisions about health, about law, about policies, about economics, and that's what needs to change. Actually doing a two-pronged approach where we're starting from the grassroots and from the community up, trying to reach more than 1 million young people around the world. We're doing that through this campaign. So asking young people one very simple question: what do you want for your health and well-being? Young people around the world can access this survey on a WhatsApp-based chatbot and put your answers in. 1 million of us are joining this campaign to make our voices heard about what we want. And using these 1 million answers from young people all around the world, we're presenting these answers and these demands and these responses at the Global Forum for Adolescence this October. What's the Global Forum for Adolescence? It should be hopefully the largest gathering of young people, and it should be the 11th and the 12th of October. So calling all young people, calling anybody who works in the youth space, this is an open invitation to everyone. And here this brings us to the top-down, or maybe the policy level approach. What's happening at the forum is that we are presenting these million demands to policymakers and asking them to be responsive to these demands. So when 1 billion young people around the world are not represented, 1 million young people come forward and say, these are our top demands for our health and well-being. This is the space for us to listen and see how policymakers are going to respond to that. So again, we are very excited about some of the policy level parliamentarians, decision makers, leaders around the world that are championing this initiative. And we cannot wait to see more commitments, more political and economic financial investments in the health and well-being of young people. And that will take all of us, from the highest person in government to the youngest person in the country, raising their voice and working together.